Well, hello there. I'm Elkon, and I'm going to take you through a few slides that describe Brian Lambert's Delta project. Brian works at La Clinica. It's a network of health clinics, dental suites, school-based health centers, and a mobile unit in Southern Oregon. They put a lot of value in communicating effectively, and Brian found that storytelling is a great way to present information. I think he said you guys even learned how the city of Minneapolis used the storytelling process to hear from different cultural communities within the city and to improve services and even inform new policies and practices there. Quite fascinating. Anyway, when Anastasia wrote that you can choose the format, including stop-motion animation for your project, Brian got really excited. He does a lot of customer service work at La Clinica, so he's been playing with animation for just about a year, producing Skill of the Month videos for staff. Well, you can ask him about that later. I've got a story to tell. Last fall, Brian Lambert's mind was swirling with possibility. He had been appointed to the Equity, Diversity, and Inclusion Council at La Clinica. He was accepted to be a part of the 2016-2017 Delta cohort, and 2 days before attending the Delta orientation, he sat through a webinar on the new features that was being added to the electronic medical record. Clinics would now be able to get accurate sexual orientation and gender identity data known as SOGI. That's S-O-G-I. By adding these additional demographics to things like race, homeless status, age, etc., care teams would have more tools to address health disparities that lesbians, gays, bisexuals, and transgender people in Southern Oregon face. So jump ahead a couple of days, and he's in Portland, hearing details about class standards and whatnot. A connection was made, and Brian knew that collecting SOGI data was the first step in providing effective, equitable, understandable, and respectful quality care to the LGBT community of patients. A project was born. In fact, Brian felt a little guilty at how easy this would be. Before taking over as the coordinator of the organization's call center, he ran one of the bigger clinics. He knew a thing or two about managing a new change in the EMR system. He had to simply get the technical team to create some instructions, with screenshots if possible. Next, he would talk to his colleagues who led the front desk staff for the organization, and then find a time for them to learn how to integrate this change into their process. Now, these are skilled and resourceful people. This wouldn't be a problem, he figured. Just as Brian began working on the logistics of his project, he was learning more about the work of the Equity, Diversity, and Inclusion Council he was a part of. He was asked to co-facilitate a cultural agility training for new staff, and in the process of the council assessing the effectiveness of this presentation, he was hearing about some of the barriers that LGBT patients had faced at La Clinica, including the case of a young transgender patient. It was clear that though La Clinica is welcoming and inclusive, for most people, they still have some room to improve. As Brian started to test the waters and began talking about staff collecting SOGI data, La Clinica was simultaneously reconfirming the organization's policy on non-discrimination. The fall and winter months were already very politically polarizing across the country, and it seemed that the perfect storm was brewing. He could only guess how his suggestions for change was being taken. It was mid-January by now, and though Brian and the topic were on the agenda for a couple of ED&I council meetings, there was not much progress being made. 2 months went by. Site operational leaders understood that clinicians needed accurate data to address the unique health issues of LGBT patients, but they were concerned that staff was not equipped to ask patients their sexual orientation or gender identity, nor were they prepared to answer questions if patients wanted to know why. Now, during a council meeting in March, out of frustration, Brian said, "I wish we would quit getting so much pushback. This is a UDS requirement." Now, y'all probably already know this, but UDS stands for Uniform Data System. Each year, the Health Resources Services Administration, that's HRSA, asks grantees like La Clinica to report on their performance using the measures defined in the UDS. In other words, their funding would be at risk if they didn't start collecting the data this year. Shortly after that, senior leaders confirmed that this was true, and things started to move at a breakneck pace. This was no longer a philosophical question of should we, it became you will, and unfortunately, much of the communication was happening via email, and you know how that goes. Nobody publicly said we shouldn't collect SOGI data, but imaginations went wild, as staff and leaders alike imagined receptionists gathering an inventory of patients' sexual organs or something like that at the front desk. A work group of the council was formed, to be led by Brian, and he invited some passionate site leaders, opinionated members of the ED&I Council, and the Learning and Development Coordinator to the table. Their task was to develop a training plan for preparing staff to collect sexual orientation and gender identity data by July 1st. Frankly, Brian was really anxious about their first meeting. To borrow from Doris Kearns Goodwin's Pulitzer Prize-winning biography of Abraham Lincoln, this was a band of rivals. The reputation of the Equity, Diversity, and Inclusion Council was on the line as he tried to lead one of its very first big initiatives. But something interesting happened. In addition to valuing communication at La Clinica, like I said earlier, La Clinica values relationship. It's even one of its customer service standards. Brian made the decision not to discuss potential financial fallout, which seemed to generate defensiveness. Instead, he would focus on connecting with and hearing the concerns of his friends. They started by looking at some of the real health disparities that LGBT patients face. And then they looked at La Clinica's mission, and they drafted a rationale statement. It's part of our mission to serve patients with barriers to health care, and the LGBT community suffers significant disparities. We have a great track record of setting and meeting quality metrics when we have accurate baseline data. By the end of that 90-minute meeting, they had a timeline with specific dates and a training plan that everyone felt good about. This plan started with educating leaders, followed by bringing in professional trainers to prepare frontline staff. There was also a commitment to do continuous trainings after the launch date. Now, up to now, a new demographics form has been designed to collect SOGI data right alongside other demographic data. Leaders have completed their training and are expected to hold listening sessions with their staff by the end of this month. A PDSA, now that stands for Plan, Do, Study, Act, has begun at one of the health centers to trial the new process. As Brian was putting the finishing touches on my animation and recording my voice, recording my voice, other items on the timeline are coming along nicely. Well, I'm at the end of my story of Brian's project, but I want you to know that the story doesn't really end. Lesbians and bisexual women are less likely to get preventative screenings for cancer. LGBT populations have the highest rates of tobacco, alcohol, and other drug use. Men who have sex with men are at a higher risk of HIV and other sexually transmitted infections, especially among communities of color. LGBT youth are 2 to 3 times more likely to attempt suicide and more likely to be homeless. These health disparities are significant and can't begin to be addressed until we have accurate data. But collecting data and addressing disparities are only 2 legs of a stable 3-legged stool. The third leg is where the real work begins. La Clinica is continuing its goal of being a welcoming, and inclusive environment for all. Thank y'all for listening.